So we have been studying health in various aspects in our curriculum and what we see in our daily practice. We look into something called as tertiary care, which dominates our lives because we see people who come to the inpatient department and get admitted and then they go away. So what, according to you, based on your experience in UK, are the areas in which care can impact healthcare services, and especially when we look at India?
So, a functional care practice system basically reduces burden on care systems, through promotive health, prevention, early diagnosis and safeguarding individuals. So basically, if you look at, let me explain to you safeguarding so everybody understands it, because I mentioned safeguarding before. So safeguarding is protection of all individuals from abuse and harm. So the idea is this is based on physical abuse, emotional abuse, sexual, financial, neglect, discrimination, domestic abuse, and it could also be institutional. So we can actually improve patient care systems better through quality risk of managing so many things like hospital-acquired infections, precious care risks, and basically treatment and management errors. With regards to vulnerable people. So just kind of giving you a gist, when you look at a care system, it's basically when you look at seeking for health. Now WHO also today is celebrating the World Health Day, looking at my health, my
Correct.
right.
Correct.
So when I look at my own right as accessing to health, I'm basically looking at making sure that I am at a better state of affairs when I'm looking at seeking health and just being healthy. So I have those options and everything. So with care, what happens is that when you're looking at not just vulnerable communities but any community, when you have a basic level fundamental place, like if you look at it from the analogy I can give you from the ASHA perspective. Now you have a volunteer-based system in India where ASHAs are basically going and delivering services, but you're also looking at promotive care, preventive care, early detection. So when you have people like this in the community, they will then improve the knowledge, they will improve the promotive health modality, they will improve things to an extent where we then say, okay, fine, this person is able to bring somebody to the hospital in an earlier stage compared to them going into debilitating stage. Like when we look at people living with dementia, when they have a urine infection, you can diagnose urine infection much earlier. It takes about 4 days for them to actually develop a full-blown sepsis-like condition where they will require hospitalization and then having antibiotics, etc., etc. But if I have to reduce that 2 week hospitalization and then the 6 weeks of reablement to bring them back to a baseline, so it's about 6 to 10 weeks that they're basically going to be struggling with the care system. That will increase the cost to the care system, that will increase the cost to the care professional, increase the cost to the family. So hospital systems can actually look at benefiting out of this because it brings down cost of care. So families, communities can benefit out of that. What also happens is that, another area that can impact healthcare is basically on the advent of medical tourism, because now we see a lot of foreign countries collaborating with developed countries which have better health system, and India is basically a pioneer in that aspect in the long term. So when we look at nurses, when you look at yesterday I trained physiotherapists, we're looking at allied care professionals. Very few of them actually know about how to deal with vulnerable communities like people living with dementia, people living with autism. But in general, it's also not a part of our culture to actually look at patient care because it's all treatment oriented. So that's one of the reasons why care systems or care practice needs to kind of evolve in India. So I think hospital systems can benefit a lot from that perspective. Even a small thing, like for example, a nurse has a lot of skill and responsibilities, but then we can also have in UK we have healthcare assistants. So they will do critical tasks that nurses can get off on, and then they can specialize on their focus areas. So that also supports costing because at the end of the day, everything is based on cost. So we can delegate some roles to a lower functionary who can do the same tasks at the same level of expertise as against clinical tasks where the nurse is basically.
Correct. No, no, that's absolutely correct. And looking at the day we are today, 7th of April, and looking at my health, my right, I think training people is very important because that directly impacts client and patient care.